Thank you for helping explain what's been good.
Yes.
So this is 2 weeks break since you were in last.
Yeah.
And so far things were going well when last I saw you.
Yeah.
But just for the record, do you mind telling what had happened to your feet and why you came to see me?
About 4 years ago, I mean, I've always had a bunion. They've told me for years that I was probably going to start to bother me, but it never really bothered me until 4 years ago I hit my second toe, like I stubbed it, and it crossed over my big toe. And like it started causing pain to put shoes on or whatever, and it was just, I couldn't straighten it out for anything, so I would tape it. I taped it with Band-Aids, tried to straighten it out, you know, keeping it away from, but I still got pain from it, and it was, like I said, wearing shoes was an awful pain. So I went to see my GP first, and then he sent me to an orthopedic surgeon, and I had surgery I guess this March it'll be 2 years, and I've had chronic ankle pain ever since. And that's why I'm here to see you, to see if, and it has made a big difference, really.
And then also your other foot was also experiencing that.
That's right. My other foot is starting to cross, and I've got like hammer toes, and it's same thing, starting to bother me when I wear shoes. But now it's like, and it was starting to cross, but ever since I've had the treatment, my toes are getting a little bit straighter.
Great. And with the 2 week break that we had, did that also remain the same?
It did. They stay straight when I'm walking, but if I try and, like I do a lot of yoga, and when I do the yoga poses, the toe starts to cross a little bit, but not as bad as it used to.
Okay, that's good. All right, that's wonderful. So we've seen your x-rays, and maybe we could take a view of your feet before we work.
Okay.
And you were mentioning as well how the ankle pain becomes more of a shooting sensation now. So the last time I taped your ankle, did that give support for an amount of time?
Yes, like while it was taped, it was great. Yeah. And then I kept it on for the tape on for about 36 hours. And then when I took it off, the ankle pain was pretty bad to start off with, but it got better pretty well. Like, it lasted for about 20 minutes, the pain, and then it dissipated. And then the next day when I worked standing up all day, at the end of the day, it was much better than before. But I like working with the tape on my feet, that's for sure. It makes a difference.
Yeah. I mean, one of the things is you are wearing some insoles, I think.
Yes, I wear the Dr. Scholl's half insoles. Yeah. And I have 2 pairs of those, but I change my shoes pretty well every day. I just try and wear something different every day.
Yeah. Okay, that's good. And I think that, I think that's a really good approach for sure.
Yeah.
Okay, let's have, I'll just take the camera and tape your feet now, so that we can see how they are without the tape on. And it's great. So the right foot is what had the surgery.
Yes, this foot had the surgery. Yeah. This toe completely went over this way. And now it's straight from the surgery, but now I have like a swollen ankle.
Yeah.
And it's basically giving me chronic pain in here. Like I get shooting pain up through here, and that's where the shooting pain is, and then like more of a chronic pain that is in this area here.
And that's like an ache?
Yes.
Okay. And then...
but that ache is gone since I've had your treatments.
Yeah. With shoes, different heights of heel, what's the best and most comfortable?
Something like this. Something along these lines, like a half an inch to a 1 inch heel. Okay. If I go any higher, which, I did about a week ago, I did about a 2.5 inch heel. No. Didn't like that very much at all, so I keep with the lower heels. It's much better.
Thank you so much. Okay, so I'll just talk it through, that way everyone will understand it. So move 1 is over hallucis longus extensor. Move 2 is going to go from the distal end of the malleolus through the groove between the malleolus and the talus. So we take skin onto the malleoli, challenge, and move through the groove. And then we return, take skin towards the top of the foot, challenge, and move through the groove toward the calcaneus. Leave the finger there, and then on the opposite side, between the groove as well, we're going to position the thumb pad, taking slack towards the top of the foot, challenge into the groove between the medial malleolus and the talus, and move through over the ligaments. Very simple. Now these fingers become holding points, and we leave them exactly where we did the moves. So we're touching both the malleolus above and the talus below. We're right in the middle, and this becomes a fulcrum for our flexing of the joint of the foot. We challenge fully by stressing the foot and the ankle joint, and then a final push beyond the flexion of the ankle joint. So that's the ankle procedure. Now the hammer-toe procedure, we're going to take thumbs into the middle of the ball of the foot, slack towards the heel, challenge, and then move toward the toes. And now with the fingers on the underside of the metatarsals and the thumbs just sitting above, we can flex the joint comfortably from the big toe to the little toe, and you only need to do this once from the big toe to the little toe and then back again, really stretching the skin over the joint of the metatarsal, and then here at the joint on the sesamoid. So that's then the hammer-toes procedure. Now we'll do the bunion procedure, which involves straightening the big toe and then moving at the level of the joint over hallucis longus extensor, like so, and then little moves around the joint as if to massage the bone itself, taking the movement of the skin to really press in to the joint. These areas can be quite sensitive, so be sure that you're not hurting, especially when you hold the toe. Don't hold it on the sides, just hold it at the joint from the top and the bottom. Now we're going to flex the joint by separating it and using the thumb as a fulcrum, like so. Thumb tips are right underneath the joint, and we just stretch the joint open. Okay, so now the ankle tape. We'll prepare a couple of pieces. In this case, the pain is on the medial side, so we're going to work from the lateral side towards the painful side and give the support to the ligaments on the medial side. So the first piece is a stirrup. It's going to wrap around from the outside to the inside. We're going to lay the tape like so above the ankle joint, and we're going to be able to stretch the tape around the heel, squeezing the joint as we go around it and wrapping around to the medial side of the leg. So now this medial side is shorter and tighter. So a secondary piece is to lay the tape on an oblique angle this time, starting from the front of the leg. We're going to wrap around the heel, using the stretch of the tape to pull the ankle into eversion, like so. And then this piece can wrap around and secure the ligaments like so. So a couple of things to notice: that the ankle is at 90 degrees, the foot is flexed inwardly, and now this tape will hold it and protect the ligaments that are strained, just as if a sling. So I'm going to put another piece around the leg just to hold the tape in place so it doesn't peel off. And this tape is from Trainer's Choice, and it's excellent because you can actually get it wet.
Oh, yeah.
Mm-hmm. So now we'll do another piece prepared for the hammer toes. One and two. And this piece you can cut so that it takes the shape of the toes. A little curvature like that. And now we position it at the web of the toes on the metatarsals, and then we can stretch the metatarsal pad, really pulling tight the, yeah. And now we can take this final piece and wrap around like so to secure it. Now there's a bare patch, and what I like to do is take a piece from the lateral side and pull up on the arch so that it accomplishes two things: one, to protect the skin, and two, to support the arch in a more neutral position for the alignment of the ankle as well. So this piece just secures the foot by wrapping around from the outside to the inside. So now we've got the foot in secure tape, and wearing this for a day or two, or even longer, will support the alignment of the feet. And that's it. Good.